This is FYI on your TV, brought to you by Hometown News. I'm Kathy Botham. I have got Tracey Fuller with me. You are a dietitian.
That's right.
And you are with the Rideau Community Health Services.
That's right.
And you're also the manager of community programs.
Right.
We are here today to talk about diabetes. November is Diabetes Awareness Month.
That's right.
And I just love talking about this stuff. So you're going to be educating us and informing us on healthy lifestyles and diabetes in general as well too. So you're a dietitian.
I'm a dietitian, and I've been with the diabetes team, oh boy, for about 20 years now.
Okay.
And again, with the diabetes programming at Rideau Community Health Services, we're a team of nurses and dietitians, and all we do is diabetes. So we live it, we breathe it day in and day out, and really our goal is to support people to live healthy with diabetes, because people can. We know the rates are going up. They approximate about 11 million Canadians have diabetes now, plus another 1.5 million walking around today that don't know they have it.
Right.
And so it's no longer an exclusive club. It's got many members. And so then the goal is, what are the little tips and tricks that we can do, right, in our life to live healthy with this disease?
So do you get people who are diagnosed with pre-diabetes first, and I mean that we can work with that, or after diabetes too, that you've got the actual
so
diabetes?
Both. So we do see folks with pre-diabetes, and people will call that, I have a touch of sugar, or I'm borderline. There's some of those phrases out there. All it really means is, the way I like to explain it is, your blood sugars are no longer in the normal range, and you're kind of in that waiting room for type 2 diabetes. Right? Okay. So the pre-diabetes, we like to strike while the iron's hot, because we know with some changes, you can reverse your blood sugars back down.
It is reversible, right? It is reversible, okay.
Yes. And what we want to do is, we really, if the diabetes is going to come, so be it, but we want to delay that, right? We want to give you a few more years of living free of diabetes.
And without insulin and medication, that sort of thing
exactly.
too
sometimes? Yep. So pre-diabetes, what we do at Rideau is we will book folks in with one of the dietitians, right? And so the dietitians, really, their skill set is obviously food and what we can do with our food, but also how can we move our body more, right? How can we manage stress? Because stress really puts blood sugars up.
Right.
So whether it's chronic stress, I can't afford my grocery bill, there's dynamics in my family, if I have depression, if I have anxiety, all of those pieces put our blood sugars up, right?
Right.
And so people think it's all about the food. It's really not.
Yeah, it's more than what you just put on your plate.
Yes.
Okay, now this plate you've got here, I love this
brought
plate.
my little toys that we always bring as dietitians, right? And so when we're talking to folks with pre-diabetes or folks with diabetes, they always say, okay, well, where's the diabetes food? Where's the diabetic aisle in the grocery store? And we say there isn't, right? This is just healthy eating, same as I need to eat, and Kathy, you need to eat, right? So it's really about our plate being balanced.
Right.
So as a nice little visual, this is where we start, folks, because there's a lot of people that aren't managing this yet, right? So it's the first get-go. So that half the plate we want covered in vegetables, any which way you want them, raw, cooked, in a salad, stir-fried, grilled, whatever you want to do. Canned can work. We just ask you to drain it and rinse it out with the water, right, to get a bit of the salt out. And the nice thing about the vegetables is they fill your belly up, they lower your blood pressure, they lower your cholesterol, they nourish your body with the vitamins and minerals, and they do not turn to blood sugar. People think carrots, peas, they're all going to make my blood sugar up. No, that's old information, okay?
Right.
And then down in this little corner of my plate, if you can see my plate, this is where our protein foods have to live. So it could be meat, but it could be other sources of protein too, right? Fish, egg, tofu, lentils, beans, a bit of cheese, right? Anything that's going to give your body protein. And again, the protein foods also do not turn into blood sugar. So we want to have some of them in our meals. And then we come down to our starches, and this is anybody that's watching that either has diabetes or pre-diabetes, they will generally know. Your starchy foods, if you're monitoring your sugars, that's where you'll see the rise.
And that's sometimes where we get ourselves in trouble too.
Exactly.
Yes.
So see, look at my little quarter of the plate. It's about a woman's fistful, right, of something starchy, whether it's rice or potato. Corn is one. we want you to think of it as a starch.
Right.
Okay? But like, so I'll have folks say, well, I have a bagel in the morning. So that's good. I toast my bagel, my white bagel. It's like 2 slices of toast. In fact, it's not. It's like 4. And when we actually break down how much sugar all of the starch in that bagel turns into, it's 12 packages.
Wow.
So when my body's already struggling internally to deal with the sugar coming into my bloodstream, that's going to be a struggle.
And
right?
that's a big education part of what you do, I'm
Yeah.
sure, is people are eating the starches and not realizing that actually turns into a sugar.
Exactly.
Yes.
So we get a lot of folks say, I don't eat any sweet, I've cut all the sugars out. I don't understand why are my blood sugars still running high. But then if we do a little review and notice they're having the bagels, they're having French fries, they're having burgers with the buns, they're having big portions of potatoes, all that starch turns to blood sugar. And we know, like, our body needs some sugar to run. That's our fuel. And so that's why we still keep a quarter of the plate reserved for our starch.
Right.
But it might be a portion about like that. Right? If
Right.
I'm doing corn or my rice, right? Those are the ones we really want to watch our portions. And then on top of that, we still do want to get 3 fruit in a day and at least 2 or 3 servings of dairy, milk or yogurt,
Right.
right? It's about nourishing the body with calcium, iron, all of our vitamins and minerals, fiber, not just focusing blood sugar. So that's what the dietitians can work with you on.
Now, you brought a juice box here, too.
Yeah. Okay, this is why I brought the juice box, just as a reminder again, for anybody with diabetes out there that runs into low blood sugars, right? If you're on certain pills or you're on insulin for your diabetes, your blood sugars can actually drop too low. So anything, if you're doing a finger pick or on your Libre, anything under 4, too low, right? It's a medical emergency. So we really want people to stop what they're doing, and you need pure sugar. So whether it's juice, whether it's Dex tablets you can get at the pharmacy. If it's in a pinch, the cheapest and easiest, honestly, is 3 packs or 3 spoons of sugar in a glass of water down the hatch.
Right.
Right? We don't want people necessarily treating with chocolate or cookies, ice cream. Oh, right? That can be had later, but it doesn't bring your blood sugars back up into the safe range fast enough. You just want fast sugar. So again, we spend a lot of time talking to people about how to treat their lows properly, safe driving guidelines.
Yes, right.
Right?
But like a juice box too, that's great for when you have a low blood sugar. But just in terms of having it along with a meal, like there's a lot of grams of sugar in
There's
there.
a lot of grams. Here, I got my reading glasses. So this box is 22 grams of carbohydrate. Each of these is 5 grams. 5, 10, 15, 20. I'm basically at about that amount of sugar,
Yep.
right, for that juice box.
Yep.
Even if it's unsweetened, this is an unsweetened juice. There's no sugar added to it, but it's that natural sugar concentrated in a juice, right? You've probably got 3 oranges squeezed in there, and I'm probably not going to sit and eat 3 oranges.
Right.
So yeah, we really try to get folks to focus on weeding out the juice as much as you can. There's great options out there. There's like the lower calorie juice. It's got lower sugar in it. You can dilute it out with water if you just need that hit of orange juice in the morning, but yeah.
In terms of checking your blood sugar, it's come a long way.
Yes.
It's come a long way. It used to be, it used to be a urine dip a long, long time
Yes.
ago. I remember that. And then blood sugar, you can do the finger prick, and now they've got the Libres.
Yes.
It's
So Libres, yeah, they're a game changer for
Right.
many of our folks that have had diabetes for years that didn't like poking their finger or just they felt at work they couldn't do it for a variety of reasons. So the Libre is just, I didn't bring one with me today, but it's basically just about the size of a toonie, little white patch. You apply it at the back of your arm. It's good for, I believe it's about 2 weeks. And then you just have the data flowing to either your phone or a separate reader. You scan, you just wave it, it gives you your instant blood sugar reading, right? Like it's
I know a few people who
incredible.
have children at school, and they're monitoring
Yes.
their children at school.
Yes, exactly. Yep. So diabetes, exactly what you said, Kathy, when you think of the leaps and bounds it's made in terms of we're trying to make it as easy. And as folks with diabetes just want to live their lives.
Yes.
They don't want to be special. They don't want it to stand out. And we totally appreciate that. And so anything that can just make their life easy, a discreet little scan, I'm at the restaurant, good, I know where my sugar's at.
It's really
Yeah.
a healthy lifestyle.
Yeah.
And if you follow it, my goodness, you're probably one of the healthiest people that.
And that's what we
Yeah.
often say to clients, you know, they're upset they're diagnosed. So along with the diabetes diagnosis, there's a whole bunch of emotion with that.
Absolutely.
Right? That people are dealing with. I don't believe it. Give me 3 months. I'll get it down. The test was wrong. Like, and of course, I think that's a natural reaction for all of us. And so it's trying to get people out of that mode and into the self-management.
So when
mode,
somebody
right?
comes to see you, you're much more than a dietitian. You're doing some counseling and some reassuring and yeah.
And we really do, it's a self-management condition, right? I don't live with it 24/7. That's what I say. It's your body, it's your choice, right? And when they talk about the hundreds of decisions people need to make in a day related to their diabetes, it is overwhelming. So we're kind of the cheerleaders, the coaches, just trying to keep people motivated, keep them healthy.
Right.
Once people are diagnosed with diabetes, there's a few things, right, that we really want them to focus on in order to stay healthy. It's absolutely possible. We have many, many clients that are living well into old age with diabetes, very healthy, like you said, right? One of them is we want folks to get their feet checked every year. I don't even know if anybody can see this, but it's like
There's
a little
tiny prong out of it, or not
almost
a needle,
like a
but
little fishing line,
Yes,
right?
yeah.
And so this is what the nurses, some of the dietitians, physicians, NPs, lots of folks will do this for you. And it's basically they're going to touch the bottom of your foot, and you're not going to look, and you're going to tell them if you can feel it. And that gives us a good sense of, are the nerves in your feet still intact? Are you still able to feel a stone in your shoe? Or if you step on a piece of glass or something, okay?
Right.
So we do want the feet checked once a year, minimum. They're also going to check for the circulation. Is your heart still getting nice fresh blood to your toes and all the way back to keep the circulation good? And if you get a little blister on your foot, right, can it heal up? And so we really, really encourage folks to check their feet every day.
Excellent, excellent. Yeah, and in terms of, I can go back to your plate of food too. I can remember being taught one time, it's like filling up your gas tank. Like once you get it full, you don't keep putting food in. You don't keep putting gas in your, it's like flowing all over the place. And it's pretty much what you're doing with your plate too. It's like don't overfill your plate.
Exactly.
And your body, I guess. Yeah.
Exactly. It's just keeping an eye on kind of where your portions are now and what's little changes you can do. There's a lot of folks that would not get to this overnight. There's no way, right? And so that's what we try to work with folks. What's one little change you can live with that you would agree to try? And those little changes really help, right? The other piece that we didn't address is the huge number of folks with food insecurity these days. And so I know that there will be people watching saying, I'm not affording roast beef and fresh vegetables, and we hear you. And so again, that's dietitians can work with you to try to find, okay, what can we do, right, within a really strict budget? What can nourish your body? We're trying to get folks off of the processed foods as much as possible and using real food. But again, we know that's a trick when you're faced with, I don't have much money to spend at the store. So we're sensitive to that, and we're happy to work with folks and see if we can strategize that.
Wow. Now, how do people get a hold of you?
So we have offices, we're all through Lanark, Leeds, Grenville. So our main offices are in Smiths Falls, Rideau Community Health Services. So people can call 613-284-2558. We have our Brockville office as well over on Strowger Boulevard in Brockville, and that's a 498-1555. They can go online. People can self-refer. We absolutely do not need it.
You can self-refer. Okay.
Yes. Nobody needs to go. The doctors don't want you booking an appointment for a referral to us because anybody can come and see us.
Wonderful.
And what we will do is then reach out to your doctor, your nurse practitioner, to try to get, any of your last lab data, perhaps, anything that's relevant to your diabetes, right? That we use to help decide, is it time for a new medication? Is it time to switch things up, right? Because lifestyle can only take you so far. And then we are into a whole host of different diabetes pills and insulin and other injectables that really, the insulin injectables are scarier in our minds than they are in reality.
Right.
Yeah.
Right. Now, and you have an event in Prescott, I believe you were talking about earlier?
We do. So next Wednesday, we're going to send some of our nurses, and the Prescott Family Health Team is going to send a few of their nurses. They're going to be at the Lions.
December 4th,
It's
I believe?
December 4th, Wednesday, December 4th. We're going to be at the Lions. Let me just double check the location. No, we're not. We're at the Royal Canadian Legion on Henry Street in Prescott.
Okay.
From 1 to 5:30. Drop in. You don't need to register. If you need your annual diabetes eye exam completed, because that's another one, folks with diabetes, every year we need your eyes checked, the back of your eye. So we're going to have nurses that can do that. We have a fancy new camera. So we can do your eye screen. We can do your foot screen that I just talked about. They can teach you how to care for your feet. We'll have our dietitian and nurse there to answer any questions about diabetes. Yeah, so we just encourage anybody to come out. Especially if you don't have a doctor or nurse practitioner. We have a lot of people that don't.
Yes, that's
and
right too.
so we are happy to see you there, right?
Wonderful,
And
wonderful.
yeah.
That's wonderful. Oh, well, thank you very much. I know I could go on talking forever with you about this sort of stuff, so you're going to have to come back and we'll continue our conversation about diabetes awareness.
Perfect.
So, thank you very much. Tracey Fuller, you're a dietitian, you're manager of community programming with the Rideau Community Health Services. Thank you for joining us today and educating us more.
Yeah, thank you, Kathy.